Is there a point in a women's cycle that they might be a little bit more anabolic or training is a little bit better?
Yeah.
Where like you find like I'm a little bit stronger.
In the high estrogen time, in the follicular phase, that's when our estrogen's really rising in preparation for ovulation. So that is a time where we are more stress resilient. So we can handle like training volume and training intensity better, and we can recover better from it. We'll have more muscle adaptation. So that's really like the best time in a woman's cycle to push herself harder, as long as she has all the recovery and nutrition factors in place. And then in the luteal phase, when we have higher progesterone, that's again the progestation hormone. So our body is sort of like in this like preparation that pregnancy might occur time. And so we're a little more stress sensitive in that time. So we're not quite as resilient. We don't recover quite as well. We need a little bit more,
love and TLC, rest.
Yeah, exactly. I mean, we can still exercise, and movement is still important, but we might not have the same energy for it. Things might feel harder. We might not really want to push ourselves as much. We might feel a little more tough, like easily fatigued. And that's okay. There's nothing wrong with that.
Today's show with Dr. Elly Michelle is brought to you by Myoscience Nutrition. As you can tell, we're talking a lot about the importance of hormone balance, strength training, prioritizing muscle and high-intensity exercise to optimize body composition as well as hormones. One tool that may help you during your exercise sessions so you get more mileage from that is the novel creatine-containing electrolyte sticks by Myoscience. This new 45-serving jar contains 45 servings of creatine paired with real salt, albion chelated minerals, potassium, taurine, and a little bit of calcium as well as magnesium to help to improve healthy hydration as well as athletic performance. Each serving contains over 2.6 grams of creatine as well as 300 milligrams of real salt. You get 150 milligrams of magnesium, you get taurine, you get potassium. It's an excellent value, excellent buy. There's over 515 reviews over at myoscience.com. If you're exercising, going to the gym, doing Pilates, doing yoga, hiking, and you're not supporting your body with creatine, you're totally missing out. A lot of people, about 17% of American adults don't get any creatine at all. Over 40% of American adults get less than 1 gram per day of this conditionally essential micronutrient. You should be aiming for at least 2 grams per day, especially if you're exercising. So support your exercise sessions over at myoscience.com. Check out the novel creatine-containing electrolyte sticks now in a 45-serving container. You can save using the code podcast at checkout. Elly Michelle, thanks for coming back on the show. Very excited to talk all about hormones. We were talking offline about how there's this phenomenon of young women experiencing menopause-like symptoms. And there's a TikTok star in the UK who's apparently a singer. And I did some research into this and I was blown away at the number of early menopause associated hashtags on social media. And these are women, some of them as young as 17, 23, who are not necessarily going through hormonal menopause, but experiencing ovarian failure, premature ovarian failure. And you and I were kind of DMing back and forth about that it may not be, that it's associated with anovulatory cycles. And I would love to just, like we were talking about, talk about what happens when women ovulate and the association with the corpus lupum. Did I pronounce that right?
Corpus luteum.
Corpus luteum. Oh man, it's been a long day already. So again, this anatomy is something that we should all be aware of because as we were talking about, hormonal health is inextricably linked with body composition, with mood, energy, all of those things that are very important. So maybe let's just talk about the female cycle and then get into the weeds on some of these complexities. Okay. But, when women are starting to menstruate, what's going on and why is that process so important to hormonal health?
When they're starting to menstruate, when they first get their period?
When they're first getting, and the ovaries are releasing the follicle and then that progesterone increases. Like maybe just go through the anatomy.
The cycle. Okay.
The cycle.
Yeah. So in the very first phase of the menstrual cycle is the menses or menstruation, which is the bleeding phase. So that's considered day 1 of a cycle is the first day that a woman will bleed. That's day 1 of a complete cycle. So she'll bleed for anywhere from, averages like 3 to 5 days, but anything from 3 to 7 days is normal. Anything less than 3 days is not normal. Anything greater than 7 days is not normal either. So 3 to 7 days is sort of the typical range that she'll bleed. And then during that time, we have a little rise in FSH, which is follicle stimulating hormone that comes from the brain. And that is basically stimulating a little pool of follicles in her ovaries to start maturing. And then also through that time, you're getting stimulation to the ovaries from estrogen. And that's basically preparing one of those follicles to fully mature and then be released for potential fertilization. And that's called ovulation, when that egg is released. And that requires the rise in LH. So you'll get like an LH surge, we call it, and then rise in estrogen. So it's the result of the LH surge and the increase in estrogen that's going to cause ovulation to occur. After the egg is ovulated, then we start to secrete progesterone and we enter the luteal phase. So that phase where the follicle is developing to be released for ovulation is called the follicular phase. So we have the menstrual phase, then the follicular phase, or some people kind of group the menstrual phase into that, and it's all the follicular phase. But if you want to get even more technical, it's the menstrual phase, the follicular phase, then ovulation, which is one day, but it's still a phase of the cycle. Then we enter the luteal phase, and that is when we're making progesterone. That's the time that's the more dominant hormone. We still have estrogen there too. So we have both estrogen and progesterone, but progesterone is really the most important hormone during that time. And then as those progesterone will peak and then it'll start to drop off and estrogen will start to drop off. And then it's the result of that drop of progesterone that will then stimulate the shedding or cause the shedding of the uterine lining, which is the bleed or menstruation, and then the cycle starts over again.
And it repeats. Okay. And at what point in that phase are women most susceptible to becoming pregnant? Like if they're in a sexual relationship with a partner and maybe they want to get off hormone or birth control, I think a lot of women are very scared of going off the pill.
Because it could happen anytime.
Right. But you're only really fertile for like a 6-day window, I've heard you say?
Exactly. It's the ovulation day, of course, that egg is released, that you're fertile. But then it's the 5 days leading up to ovulation. You also consider yourself fertile because sperm can survive in a woman's body for up to 5 days. And so even if there's unprotected intercourse 5 days before she ovulates, the sperm could still be in her body when she does ovulate, and that could cause conception.
Right. Okay.
Or fertilization.
And what do you think of the accuracy of, say, the Daisy app, and there's all these core body temperature apps that will indicate phases of the menstrual cycle? Like there's some online pundits, more conventionally based, that will say they're not accurate. Like women still get pregnant and so forth. What's been your experience working with clients in that way?
So I think that they're not necessarily apps, but there's a word for it. It's like femtech, like the technologies that help women with tracking their cycles and knowing when they're fertile or not. The ones that use like basal body temperature, those are accurate because basal body temperature is one of the ways that we can track where we are in terms of fertility. But if it's just an app itself, like you just go on your phone and you download an app and you tell it where you are in your cycle, and then it starts to tell you like, oh, this is when you're going to ovulate. This is when this is going to happen. Those aren't accurate because your body isn't like a robot. It's not going to be exactly the same every single month. You can't just say, oh, I always ovulate on this day, or my period is always this many, a full cycle is this many days, because it can fluctuate. And so the most accurate way is for a woman to actually understand her body signs and be able to know when she's ovulating and where she is in her cycle on her own. You can't predict it. You just have to kind of watch what's happening. So there's definitely a learning curve. It takes time to really learn how to understand the signs from your body and how to interpret them. But it starts with just like wanting to learn about your body and being curious about it and paying attention every day.
I think that's really important.
Yeah.
And I think, the downside of hormonal contraceptives is they kind of take all of that body awareness out of the picture
100%.
because you're slamming down all the hormone levels. And while that might be convenient temporarily because you're not having your period, you don't have to bleed and all that, there are health issues that I want to get into later associated with that. But
it really disconnects you from your body because there's nothing going on hormonally, like everything's just sort of flatlined. And so you just like you stop paying attention to it because there's no real reason to, and there's nothing there to pay attention to. But once you are actually making hormones, then your body's going to start being influenced by that, and things are going to be fluctuating, and you get to start, if you're really like an active participant in the process and you're watching and you're curious about it, then you start to see that there's so much that you can learn about yourself and know about yourself just based on how aware you are of what's going on with those hormonal fluctuations throughout the cycle.
That's such a good point.
Yeah.
Jeff Bland has talked a lot about that. The difference between functional medicine and conventional medicine is that functional medicine, in addition to other things, the patient or the client is participating in their health improvement. Whereas when you go to an allopathic doctor, you're just more of like a bystander.
Yeah.
Okay, here's this medication. I'm going to take this, and that's basically it.
It's taking like the personal responsibility completely out of it. You're putting it like all in somebody else's hands when it's like it couldn't be farther from the truth. Like you really are the one that is in charge and responsible for what's happening with your health.
I love that. And here's what's interesting about this from a societal perspective. Anabolic steroid use in men have been really characterized as maladaptive and unhealthy. You're suppressing testosterone, you shrink your testicles, but women have been using endocrine suppressing medications, i.e. the pill, hormonal IUDs, there's implants and all that. And there's no sort of stigma associated with that. That's considered normal. So it's, for some reason, it's bad for men to suppress their testosterone, but it's totally okay for women to suppress their progesterone, estrogen, and all the other, estradiol and so forth with exogenous hormones. That's really what hormonal birth control is. And that leads us back to some of the side effects there and the anovulatory cycles. And that's something that you really speak a lot about. Maybe let's define because some women are having light, bleeding and stuff, but they're not really cycling. What is an anovulatory cycle and why is that harmful?
So an anovulatory cycle is basically when a woman doesn't ovulate. Anovulation just means no ovulation. And so typically the way that will look is that she can still have a bleed, like a withdrawal bleed, because she's having stimulation from estrogen still. So there's this buildup of the uterine lining causing, then she'll still have a shed, she'll still have a bleed or a period, but there's no ovulation. And so when there's no ovulation, then you have no progesterone. So that basically leads to a state of what we refer to as excess estrogen or estrogen dominance. Some people refer to it as that, or unopposed estrogen. Unopposed just meaning like it doesn't have any progesterone around to keep it in balance. And so that can lead to symptoms like heavy bleeding, period cramps, prolonged bleeding, things like that. And progesterone is a really important hormone. So she might have like different mood symptoms. She might have more PMS symptoms, anxiety, irritability, bloating, all the things that are not fun. So ovulation is very important. And anovulation is a common reason for a lot of like menstrual related complaints that women have. But you can also have you can ovulate and make not have enough progesterone production. So that will
cause the same symptoms.
Yeah.
Okay.
So it is, you really do, this is where like the paying attention comes into play, because it's pretty obvious if you know what to look for. It's pretty obvious if you're ovulating. For a woman. And I mean, I'm not sure we can talk about that.
Weeds, like what would that look like?
So we'll get real like
nitty gritty.
Yeah, nitty gritty. Exactly. So basal body temperature is one really easy way to confirm if you are ovulating. It doesn't tell you when you're ovulating, because the basal body temperature will rise if you're ovulating. That's based off of progesterone. It increases basal body temperature and it raises the metabolic rate. So after ovulation, you'll start to see a rise in basal body temperature. And so you can confirm ovulation if you see you have to be taking your basal body temperature every day. And this is what some of those like femme technologies are doing when they tell you like that you're not fertile anymore because you've already ovulated. And so the fertile window has passed. But if you are taking your basal body temperature, like with an oral thermometer, and you can actually see it, if you see 3 consecutive temperature readings that are higher than the previous 6, that confirms ovulation. Oh. So that's a way that a woman can confirm that she is. But if you want to know when you are, the best way is to be tracking her cervical fluid or cervical mucus. And so ovulation cervical mucus will look like a raw egg white. It is clear, it is slippery, it is stretchy. So she can see it when she's going to the bathroom, if she's wiping, or it might be in her underwear. She'll see that clear, stretchy, slippery cervical fluid. And that is cervical fluid that is conducive to the sperm surviving.
It enhances the ability of
Yes.
Interesting.
They can swim very easily in it because it's so it's a perfect pH for them also. So that is the day that she'll know that she is ovulating if she sees that. And it will typically only be for one day that the cervical mucus will look like that. But leading up to that, she'll also have cervical mucus that will look more like lotiony, creamy, It's slippery, it's lubricative, and that will be leading up to the ovulation day. And so that's how she knows that she's in her fertile window. She's getting close to ovulation. She's in that time where, like, if there was sperm around, it could lead to pregnancy because she's seeing that cervical mucus. So that's a pretty clear sign that you're ovulating if you have like lubricative days in the 5 days leading up to ovulation where you're producing cervical mucus, and then followed by you have one day where you're making the ovulatory mucus, which is clear and stretchy, and what I just described. So that's pretty much how she can know. There's also cervical position, which is harder to do because you have to actually like feel internally to feel the positioning of the cervix, which you can definitely do, but I don't talk about it as much like when I work with women, just because it's invasive. Not everybody wants to do it. I mean, it's great. You get to know your body a lot better, but it's a little harder to learn that than just watching your cervical mucus changes. It's a lot easier to do.
And by watching, we're talking about just when you're wiping or looking at your underwear, or literally every day going in.
Every day, you're just kind of checking out what's going on. and that will tell you a lot.
That's good.
And you'll see the patterns too. I mean, if you're doing it consistently every day, after, several cycles, you'll start to see like, oh, this kind of always happens around this time. And then I have my ovulation day and I'm seeing this, you can see the quality of the cervical mucus and how it's changing in that fertile window. And so after, you're seeing that every month or every cycle, it just like becomes normal and you know exactly what's going on. Okay, I'm fertile right now. I'm in my fertile window. And then now I'm not.
Right. So you know what to look for. And then maybe after like 2 months or 3 months of doing this, you kind of know what to look for, what to expect. Mm-hmm. And then once you learn your body, then you can maybe rely upon the basal body temperature changes like you mentioned, and have a little bit more confidence.
Yeah, so you can be watching your cervical mucus changes in that fertile time as you're approaching ovulation. And then if you're taking your basal body temperature every day consistently, then if you can confirm it by the increase in basal body temperature. That's sustained. It's continues until eventually it will drop off, and then it'll be followed by a period. But an important thing for women to know is that you have to ovulate to have a true period. So menstruation follows ovulation, or ovulation precedes menstruation. So that's a really important aspect of a healthy cycle. Is just you have to you ovulate and then you menstruate.
Well, you've laid this out very logically in time, sequence, order, and so forth. It seems that in sex ed, this should maybe be talked about, and maybe I ignored sex ed, the details.
No,
but
it wasn't. It wasn't taught. No.
This is insane.
No, it's not
like women should be taught to better understand their bodies from a very young age.
Yeah.
So that they understand. I mean, instead, is it just maybe because it's so much more simple just to give a pill that suppresses it all and say, forget about it? I mean, what's going on here on the bigger picture?
I mean, I don't know. I don't know why. I mean, I do know that I think that the way that sex education is taught in schools, it's very fear-based. Like, don't get pregnant. Don't get an STI. Yeah. And so it's all kind of like, it's just like instilling fear instead of sort of like empowering us with knowledge about how our bodies work.
Right. Which is great. And that's what we try to do, on these podcasts and so forth, with continuous glucose monitors, with blood work, with sleep trackers is, and it seems that, again, because hormones play such a big role, we're going to get into muscle health and metabolic health. And I really actually want to go back a little bit to bloating. This is so common. Women are bloated. They always feel like they have a brick in their stomach, and that connection between low progesterone and GI issues. Mm-hmm. I want to drill down a little bit more on that because, again, this is so common. Does it affect motility? Is it the microbiome? Like, do we know how the connection between specifically low progesterone and GI issues?
So it's interesting because it can kind of go one way or another. Like, progesterone itself actually can cause slowing of motility. And so just in a normal healthy cycle, with healthy amounts of progesterone, there can still be some degree of bloating. It also does cause some water retention as well. So that can be part of it. But typically, I mean, there's definitely an association with estrogen dominance or unopposed estrogen and gut issues. This is because there's such a link between the gut microbiome and estrogen. And if there's imbalances or overgrowth of certain unwanted bacteria in the GI tract, they can actually cause the body to reabsorb estrogen. So they're not detoxing their estrogen. Their body's holding on to estrogen that is kind of like expired. Mm-hmm. Like, it's done its job, it needs to get out, but it's hanging out, it's staying around for too long. And that can lead to bloating and other kind of more estrogen high estrogen associated symptoms, even if estrogen itself isn't high, but it's just causing this kind of imbalanced estrogen to progesterone ratio.
Okay.
So it definitely, I feel like the link is more associated with estrogen and the gut microbiome.
I see.
Yeah.
And an important thing that I've heard from different people at seminars over the years that I've been sort of doing this work is estrogen need not necessarily be super high, but to underscore it's the unopposed.
Exactly.
And so that's
why
ratio,
we need progesterone, which means we need to ovulate.
Right.
Which means we need to be making enough estrogen in order to ovulate.
That's, I think, really important
Yeah.
for people to understand, especially because many people have been suppressing ovulation by way of hormone and birth control for a long time.
Exactly.
And so that leads to the next logical question is, if someone has been on hormone or birth control, many women have been on this since they were 15 years old, and they're now in their 30s and 40s and starting to think about having children or whatnot. What are the realistic expectations for after transitioning off either a hormone-bearing IUD that has progestin and or estrogens, synthetic, by the way?
The IUDs will only have synthetic progestin.
Oh, okay.
Yeah, the hormonal IUDs will only be their progestin based. Progestin is like the synthetic pharmaceutical
Of progesterone.
hormone, but it's not a hormone. It's just a synthetic it's a pharmaceutical substance.
Right. Which, by the way,
but
has...
they don't have estrogen in them.
Okay, just progestin.
Yeah. But the oral contraceptive pills do have either a combination of synthetic estrogen and progestin or progestin only.
Okay. Have you personally ever taken these, like when you were younger?
I was on oral contraceptives for a short time. I think it was very briefly when I was in college, maybe like a couple years, but thankfully not a very, very long time. Yeah.
And how did, because you have learned a lot about your body and all that, how would you say subjectively or anecdotally you felt on that versus off that?
It's very hard to answer, because the reason that I was recommended by medical providers to be on the birth control pills was because I wasn't getting my period. So they were trying to, like induce the period, which it doesn't work like that. Like you're not getting a period when you're on birth control. But I was told that it was better than nothing because I wasn't making estrogen to protect my bones at the time. They were worried about the consequences of me not having enough estrogen. And so I was told to just go on the birth control
to get estrogen.
Some amount, but it's synthetic. And I now know, obviously, that it's actually not doing that. It's sort of just like continuing the problem that was already there.
Right. Making matters worse.
Yeah.
Interesting.
But so I was already without my period. I was already in a low estrogen state. So at the time, I can't say that I really noticed anything, because I was already like my default, my norm was a low hormone state. And it had been that way because I had an eating disorder as a teenager. And so my period went away. And then even when my eating disorder stabilized, it still took a very long time for my period to return. And so in that time, that was when I was on birth control for a short amount of time. But I couldn't tell you that I noticed a strong difference because I didn't have much to compare it to.
Sure. And how long did it take to regain normal cycling after you changed your dietary habits and everything like that? Was it years or months?
No, I mean, once everything clicked, my period came back very quickly. I just had to, it was honestly kind of the combination of eating enough and relaxing, like lowering my stress levels more, and kind of like my nervous system just became more relaxed. So once I had everything there, like in place, then it just basically turned back on. But it took a while for me to understand all the things that I needed to do differently for that to happen. So
stress and mood really do impact. It's a bidirectional system with hormones. Yeah, especially for women.
100%. I mean, your hormones themselves can really influence like your overall well-being and mood and just sense of vitality. But it also, there's sort of like a psychological, emotional, mental component that will influence what your hormones are doing. So it's very much they both influence each other, if that makes any sense.
Interesting.
Yeah.
So a lot of people do have fears about coming off hormone and birth control.
Yeah.
Fears like, oh my gosh, I will turn into a crazy person. I've literally heard this from a client if I go off the pill.
Yeah.
Can you speak to why that might be? Is that more the progesterone deficiency or excess unopposed estrogen? And then again, how long should one realistically expect? Is this going to take a year? For example, with men on steroids, if they've been doing steroids for 20 years, it's not like in 3 months their natural testosterone is going to kick back. You could take
Yeah.
HCG and Clomid and Nolvadex and these things, but it could be, a year or 18 months until things come back online. Is it similar for women in that way?
It really depends on the woman. Every situation is so different. I mean, I've seen situations where a woman goes off the birth control pill and I mean, you have to have that first withdrawal bleed, because that's a natural thing that will happen with the birth control pill is you have the withdrawal bleed. So she'll have her withdrawal bleed from the birth control pill, and then about, a month will go by and then she'll have a period, like literally right away. I've seen that happen, but then I've also seen it take, months.
Okay. 6-8 months.
Like, could take a year.
Yeah.
So every situation's so different. Every woman's so different. How long she's been on it plays a role too. It typically will take longer the longer she's been on birth control.
Makes sense.
But then of course, like all of her lifestyle, her nutritional status, her stress, all of those things are going to influence like how quickly or how long it takes for the cycles to resume. And another important thing for people and women to understand is that everything that her hormones are doing, or the way that her ovaries are producing hormones, it's all coming from the brain. Like your brain controls everything. Right. So whatever the brain is perceiving constantly, all the environmental stimuli and everything that's going on. And so that really is about kind of the brain healing and the brain ovary connection coming back online. If that's been suppressed, which is what birth control is doing, it's cutting off that constant communication between the ovaries and the brain. It takes time for them to learn how to communicate with each other again.
Right. With LH and FSH and the whole thing. And then going back to the follicles themselves, obviously ovulation is a natural way to sort of not regenerate, but you're getting rid of some of these follicles. What do you think the side effects are of, again, suppressing ovulation with exogenous hormones, hormonal birth control, contraceptives? All those follicles are just sitting there. They're not getting those messages. I mean, do you think there's consequences associated with that?
That's an interesting question. I don't know the answer to that. I don't think there's any consequences that I'm aware of, but there's so much. We're learning more all the time about the long-term effects of being on birth control. So I'm sure that we're going to be learning more as time goes.
Yeah.
About the effects of that.
Well, it's really interesting. If you look at the, I believe it's a Nurses' Health study that looked at the use of hormone replacement therapy, but it was specifically the progestins that were linked with cancer and heart disease and all that. But yet young women are put on synthetic progestins, like you mentioned, the IUD, as well as the pill at a very early age. And we're seeing now women in their 30s and 20s getting breast cancer or uterine cancer. And so I think, not enough people are talking about the problems there, because again, for the pharmaceutical companies to be able to patent these molecules, they're looking at progesterone or estrogen or estradiol, and they're tweaking molecules just enough so that they can patent it and put IP on that. And that is having off-target effects, suppressing testosterone, as binding to different receptors, maybe affecting sex hormone binding globulin, the list goes on. And so I think it's not enough people, they think, it has progesterone, but it's not.
It's not progesterone. I call it, people call it, it's hormones, but it's not hormones. Like the things in the birth control pills and the IUDs, they're not actually hormones. Like the hormones are what your body's making. But in these external devices, they're just pharmaceutical substances that affect our hormones.
Right. They bind to the receptor. They're analogs.
Exactly.
So to speak.
Exactly. And so going back to what you were saying with some of the cancers that we're seeing and some of those long-term effects, what my understanding is that that's likely because of the lack of ovulation, the lack of progesterone around, causing, even though when you're on the birth control pill, you're still suppressing estrogen, but there's still going to be some estrogen around, because as women, we're going to make estrogen no matter what. It's just not going to be enough. But it's that progesterone that kind of keeps the estrogen in balance and keeps it from causing proliferation, because estrogen has a proliferative effect if it's unchecked.
I see. So having progesterone around is key.
It's protective.
Fascinating stuff. I don't think enough people understand that.
No, that's why a woman ovulating for her reproductive years, it's about so much more than just reproduction. There's so many protective effects in terms of our longevity.
Really important to recognize, especially because estrogen, the ER receptive, ER positive cancers and so forth, it does act as a growth for certain tissues, right?
Yeah.
And there can be genetic susceptibilities there as well.
For sure.
Really important. Okay, let's talk about testing, and then we'll get into muscle and things like that. So I believe you use the Dutch test. Is that what you?
Mm-hmm.
So a lot of people will go to the doctor and they'll get their E2 and stuff from serum, look at progesterone. What are the shortcomings of looking at serum hormones in this context?
Well, our hormones are fluctuating every day. So if you just take a single day estrogen level of a woman, it doesn't really that doesn't tell you anything. It just tells you her estrogen on that day, but it's fluctuating all the time, right? It's like, as I was saying earlier, it's rising in the follicular phase, and then we have this peak at ovulation, and then it's going to drop down, but then it's going to start to rise again in the luteal phase. So it's always changing. And in our menstrual phase, that's when estrogen's actually at its lowest, because it's just dropped off, and so it's going to be pretty low. But then it should, in a healthy cycle, start to increase again. So, anyways, it just it really depends on what day you are in your cycle. That's going to dictate what your estrogen level is. It's different in a woman who's no longer cycling. If she's postmenopausal, then you can pretty much check her estrogen any day because she's not cycling anymore. It's going to be much more stable. And if she's on like bioidentical hormone replacement, then you want to kind of monitor, right? So that's different. But in a cycling woman, her estrogen's fluctuating constantly. So a single day isn't going to be that impactful. You can test progesterone on a single day, but you have to make sure it's timed right. So this is something that I'll see often. Like if I'm working with a woman who's gotten her hormones tested by another doctor who tested her progesterone but didn't tell her to time it in the right time, if she tested it in her follicular phase, it's going to be low because we just don't make progesterone then. So, but a lot of doctors aren't telling women to do that. So I always tell them if we're going to test it in blood, it needs to be 5 to 7 days after ovulation. So then the woman has to know when she's ovulating. If she doesn't, then it's all guesswork.
Interesting. So monitoring the fluid, like we talked about earlier, 5 to 7 days after that.
So I'll say like, if she doesn't really know, it's just watch for your ovulation mucus, then schedule your blood draw 5 to 7 days after that.
Easy.
Yeah.
Yeah. And then if you're looking there at the relative proportion of progesterone to estrogen, that would be an accurate time to look at that.
Say that again?
If you're looking at the relative ratio between progesterone and estrogen in that 5 to 7 day window after that, would that give you a good insight as to the relationship between the unopposed?
That's hard to really look at the ratio just in terms of numbers. I mean, it would be obvious to me if the progesterone level were low. Okay. So optimal, we would like it, I mean, at minimum above 10, but high for fertility and for someone who wants to conceive, we would like to see it even higher than that. But definitely like at least it should be 10. Anything lower than that would tell me that there's low progesterone.
Okay.
So if the progesterone is low, I can pretty much know that the ratio from estrogen to progesterone is going to be suboptimal.
I see. And I think the link with fertility, this really resonated with me. Progesterone is progestation. And so it's like, wow, this is really important for people to understand that the importance, because we hear so much about estrogen. Women make estrogen more so than men. But speaking in regards to fertility, I think that's really important for folks.
It is. And for things other than fertility also, like I was saying, like it's so protective because if estrogen is left unchecked, it can lead to some issues, but then estrogen's so protective too. Like it gets such a bad rap, like estrogen causes all the problems, but we have a lot of problems if we don't have estrogen. We see that like when there's certain chronic conditions that we have increased risk for after menopause when our estrogen levels decline.
Heart disease.
So we need our estrogen too. Everything has to be in the right balance. We need the estrogen in the right amount, and we need progesterone too.
That's awesome to recognize. Okay, so for testing, do you like the Dutch test then?
I like the Dutch test for cycling women. Yeah, because they have what's called the cycle map. And so a woman can collect the like urine test strips. You're just urinating on a little strip of paper throughout a cycle. So then the results that we give us like her hormonal pattern of estrogen and progesterone. So it's way easier visually to see exactly what's going on in terms of just like seeing a single value from a blood test. And it's way, we could do it through blood, but nobody wants to go and get a blood draw for their every day for a whole cycle. So it's way easier and less invasive to just do it through the urine test. So I really like that. And especially for women who don't really understand what's going on with their cycle. They don't really know if they're ovulating. They're not quite sure how to track their signs. And so sometimes it can be nice to just get the data of exactly what's going on so they can see, like, if they're getting that surge of estrogen at ovulation, if they're getting a nice peak of progesterone in the luteal phase, or are things looking a little, funky. So that is my favorite way to test for cycling women.
And that seems like a great learning experience too for women to correlate. Hey, these are the symptoms. Here's the mucus, They can
kind of see like what their hormones are doing at a certain time. Cause you can see like on this day, her estrogen was here, her progesterone was here. And on this day, her estrogen was here, progesterone was here. So she can kind of connect how she's feeling at a certain time in her cycle with what her hormones were doing. And we can sort of like put some pieces together with that information.
Right.
Yeah.
Now, because that's serial samples, that test would require the patient or the client to be very much a participant in their health. Mm-hmm. So for some people, maybe they're not ready for that. I mean, does it like, how much time would that take? Like, okay, so you got to pee. Is it like 15 samples? Is it like 20? Like how many different samples?
I don't know exactly. Well, it's going to depend on how long her cycle is. So if a woman has, average cycle length is 28 days from the first day of one bleed to the first day of the next bleed. Mm. The average is 28 days, but some women will be a little less and some women will be a little more. So kind of the range can be anything from like 24 at the low end to 35. But if her cycle is 24 days or less, that's definitely a sign to do some looking into that. And anything greater than 35 days would not be normal either. So depending on how long her cycle is, that's how she's going to be collecting. And the instructions, I think it's like every day for the days leading up to ovulation. And then in the luteal phase, it starts going to every other day. So you definitely have to be, you're doing it every day. It's a commitment for sure. But
it's good data.
It's really good data for people who like the data. I definitely don't think that like everybody has to do it. Like you can track your basal body temperatures. If you really want to see that you're ovulating, you can just track your cervical mucus. So those are really, awesome, cheap, they don't cost anything, ways to sort of measure and assess the health of your cycle. And then of course, like the health of her period too. The period or the bleeding time is really, they say it's the fifth vital sign. It's a great insight into a woman's health. So if she's having a lot of cramping, or if she is having a lot of PMS and super moody in the premenstrual time, or if she's not really bleeding that much, like if they're super light and short, that's all information into the health of your cycle. So you don't really have to do testing, but if you really want to get some data, then testing is awesome for that.
That's great. And are there any common trends that you see? Like most times I can visualize if I see the person in front of me, like mm-hmm. a male in his 40s or 50s, I can pretty much look at them and their facial structure, belly fat, and be like, okay, this is what your labs are going to look like. There's oftentimes variations, but what is the most common presentation that you've seen?
Ooh.
Or is it all over the place?
It's all over the place. It's really hard to say. I definitely see something like low progesterone is really common. That's probably one of the most common hormone imbalances that I'll see, is where they are having regular cycles. They just have a lot of symptoms around their cycle, and it's often because they're just not making, like they're getting enough stimulation from estrogen to ovulate and release an egg, but their progesterone production's not that robust, and so they're still having that imbalance in the luteal phase, which then can impact just how they're feeling in that time, but then how their period is too. So I do see that a lot. I see an absence of periods a lot, where the period's just kind of like checked out, no bleeding at all. And that definitely, that has a presentation for sure. I can see just like a general lack of vitality. So yeah, and there's a lot of sort of like lifestyle and food related things that come along with that make it pretty clear to me what's going on too. So those are probably what I see the most in my practice.
And if we can drill down into the root cause, and I'm sure it's multifactorial, why women are not making enough progesterone, is it related to dieting, under eating, sleep, all that? Or are there other like specific micronutrient deficiencies that might?
It can totally be. I mean, it's multifactorial, and it depends on the woman. Stress is a huge piece of it, because again, your brain is controlling all of your hormonal output at the end of the day, because it's giving the signal to the ovaries to make the hormones. So if the brain perceives any kind of stress in the environment, and that can be like external stress in your environment, or it can be internal, like something going on in the body, or an inflammation, like infection, something internal that's creating stress. So that can affect the quality of the progesterone, or the quantity of progesterone that's being produced. But yeah, I mean, nutritional factors are huge for that as well. Getting enough calories and energy is really important. Eating enough carbohydrate, eating enough protein, eating enough healthy fats, getting the right micronutrients as well. So that's why you'll see a lot of times, like when people have been chronically dieting, they're not getting enough energy, and they're not getting enough of the right micronutrients for progesterone production. So yeah, and exercising as well, overtraining.
More common in endurance athletics, you see the low progesterone, like runners, and
yeah,
it's a common presentation. Mm-hmm. How does the low progesterone impact body composition? Is it?
It can go in different ways. It just depends on the person,
right?
Because I can see low progesterone in someone who isn't necessarily, super active. Maybe they're just kind of recreationally exercising here and there. But then you can see it in someone who's exercising every single day, like hard. So there's no kind of like one way that it will affect body composition, because it depends on all these other factors about a woman's lifestyle and nutrition, I think.
Right. I mean, I just asked that because, sometimes in men, when they're aromatizing testosterone, you can start to see, the man boob phenomenon and things. So I didn't know if there was any telltale signs.
No, I mean, you can see weight gain, you can see like increased body fat, or you can see a very, very thin woman. Both can have low estrogen, and both can be not ovulating.
Right. So in like female fitness competitors, is that quite common? Low estrogen and low progesterone?
Oh yeah. Because you need body fat, first of all, to be able to make appropriate hormone levels, and you need to have energy for that. So if you've been in a chronic low energy state, then your, reproduction is, even though we've talked about how there's so many more roles that hormones play besides reproduction, but that is kind of the main reason that they're there when we're of reproductive age. So that is non-essential to life. And so your brain is going to just be like, okay, we're going to conserve, we're conserving energy right now because there's not that much around. So we're going to not put energy towards this. We're not going to make these hormones because we don't need to reproduce right now. The environment's not safe. There's not energy available for that.
That makes a lot of sense. What is the ideal body composition for women, for hormone health and fertility, for fertility? I know with regards to metabolic health, some people talk about less than say 25, like between 22 and 25% might be sort of ideal, a sweet spot. Or do you not focus on that? Or does that come later when it comes to balancing body composition and
I mean, I don't necessarily put a lot of emphasis on it, but I know, if body fat percentage drops too low, then of course that's going to be detrimental for hormone health. So for women, we know that women naturally should have more body fat, like to be healthy, than men. And so we would see it higher than like a typical male body fat percentage. So, I think, like 20, anywhere around kind of the low 20s, I think is optimal, for women.
Yeah. I think it's a fine balance, because people might hear that, oh, body fat is good for hormones, and then think, well, I'm 40 pounds overweight, so therefore my hormones must be healthy. But then there's this U-shaped curve where it's maladaptive at a certain point. So I think context really does matter, and body composition and how much muscle and all that. So I think that's important to recognize. The connection between estrogen and building muscle in women, I think that's pretty interesting. Do you want to dive into that a little bit?
Yeah, sure. So estrogen is anabolic, meaning that it helps with building. So in the metabolism, we have kind of two different states that metabolism can be in. It's either anabolic, which refers to building, or catabolic, which is breakdown. So estrogen helps with building processes. And in order to build muscle, we need to be in an anabolic state, not a catabolic state. So part of that is we need to have that drive from estrogen, testosterone too, but that's going to be a bigger factor in males. But we actually really need that estrogen in order to build muscle and maintain it and protect our muscle mass. And so that's why when you see women who are on oral contraceptives, which are preventing their natural estrogen production, they will have, there's studies on this in the medical literature, they will have a harder time building muscle, or they won't have the same muscle adaptations as women who are naturally cycling. And then we'll see as women, once they go through perimenopause and they're postmenopause and they have lower estrogen levels, it's a lot harder to build muscle, which is why we need to do it as much as we can when we're younger and we have that estrogen, because it's a lot easier when we have our estrogen. Not that it's easy. I don't want to give that idea, because it's going to be hard no matter what, but we have the benefit of having the estrogen around. So it's a lot harder once we have less estrogen there, and the rate of muscle decline increases with age. And so it just is a testament that we really do, estrogen plays a really important role in that, and bone as well.
Right. Really important to recognize, because there is so many people have osteopenia, osteoporosis.
Risk increases again, like everything, the risk for osteoporosis, for heart disease, for dementia and Alzheimer's, all of that increases. And then we of course have increased loss of lean mass as well once our estrogen declines. So it's very, very important.
Right. It's all interconnected, which is fascinating.
Yeah.
Is there a point in a women's cycle that they might be a little bit more anabolic, or training is a little bit better, where like you find like I'm a little bit stronger?
The high estrogen time. Okay. In the follicular phase, that's when our estrogen's really rising in preparation for ovulation. So that is a time where we are more stress resilient. So we can handle like training volume and training intensity better, and we can recover better from it. We'll have more muscle adaptation. So that's really like the best time in a woman's cycle to push herself harder, as long as she has all the recovery and nutrition factors in place. And then in the luteal phase, when we have higher progesterone, that's again the progestation hormone. So our body is sort of like in this like preparation that pregnancy might occur time. And so it does want to, we're a little more stress sensitive in that time. So we're not quite as resilient. We don't recover quite as well. We need a little bit more,
love and TLC, rest.
Yeah, exactly. It doesn't mean we can't. I mean, we can still exercise, and movement is still important, but we might not have the same energy for it. We might not, things might feel harder. We might not really want to push ourselves as much. We might feel a little more tough, like easily fatigued. And that's okay. There's nothing wrong with that. It's natural with what's happening hormonally. But we're definitely much more in an anabolic state, and we're actually more insulin sensitive as well during the follicular phase.
Interesting. Yeah. So I think that's really important for athletes and women trying to improve their body composition, to maybe push it up a little bit during that particular phase.
Fun.
Right. And so do you time maybe your exercise programs accordingly in that way? And you're a little bit more intentional about ramping up the intensity during that?
Yeah, well, so for me personally, and everyone's different, so what works for me doesn't necessarily mean that it's going to work for you. But I have a coach who's doing my programming for my training, and the program pretty much stays the same. But because I have, I'm understanding what's going on hormonally, and I'm always very in tune with my body and paying attention to how I feel every day. And so I can pretty easily sort of like auto-regulate what I'm doing. So if I'm in my follicular phase and I'm feeling awesome and I feel super recovered, like I will go for it and I will push myself hard, and I bring on the intensity. But then in my luteal phase, if my energy's lower and I'm just not feeling it, I will be more likely to take a rest day or kind of push it to the next day. If I'm just not, if I'm planning on training, but I'm just not feeling it that day, I'll be like, I'll see how I'm feeling tomorrow.
Right.
Or if I'm feeling decent, I might go, but I might just, I might have to decrease the weight, or I might not do as many reps, or I might skip some of the higher intensity. Like if there's a finisher where it's more high intensity, I might skip that. So I can adjust and modify as I need to, but I won't just stop. I feel like there's sort of a trend online right now with training with your cycle, and it's like, you can do everything hard in this time of your cycle, or, this 1 week, because they're saying don't push yourself on your period, which is also not always true. And then just do nothing in your luteal phase, just rest or do yoga or do only walking. And that's not always the case. We're all different. So I think it's really important to just like I was saying before, really listen to your own body, because just because someone's saying out there you shouldn't push yourself during these times, you might actually feel energetic during a certain time of your cycle. Or there might be a time where they say you can push yourself, but you actually feel more fatigued. So there's no one way to do it.
Totally. But again, understanding the physiology and understanding your body, I think is really important to recognize and acknowledge. But yeah, I think that's phenomenal. And just, maybe doing more walking or something like that during that phase.
Walking is always great.
Totally. I think not enough people walk, which is unfortunate. We drive everywhere and sit and all that. Going back to anti-mullerian hormone, we haven't really talked about that, but that generally can be tested during when people are trying to get, when they have fertility issues. Oftentimes OBGYNs will look at that. And then also to look at if someone is entering menopause. It's a marker of ovarian reserve. How to use that in your practice, or do you? And should people start looking at that in their late 30s or?
Yeah. So I don't necessarily specialize in fertility. It's something that I definitely do in my practice because I work with women, and that's something that women have, concerns about, but it's not really the only thing that I do. And so I'm not really running a lot of AMH. I've definitely seen women come to me who have seen other fertility specialists who have done it and, might have concern about it. So I definitely think that it's like, I'm seeing it more. I definitely think that it's being run a lot more when it comes to fertility. But I'm not personally running it as much, just because it's sort of my area of focus is much more just sort of like general hormonal health and helping women just increase their vitality and their body awareness. But my understanding is that AMH shouldn't actually be used as a marker of fertility. It's really better used as an indicator of IVF success. So, I don't know. I think that women should kind of be a little cautious about putting all their eggs in that basket of like what their AMH is. It doesn't necessarily mean, it's not going to dictate your future fertility if you have a low AMH or a suboptimal for your age AMH.
Right. Because you could still have healthy follicles. Right.
You could still have healthy follicles and you can still conceive. You can still get pregnant, even if it's not, what they are saying is optimal. That is my understanding. That it's really better used as a measure of the likelihood that IVF will be successful if that's the route that the woman is going, if she's going to some of those, more like those reproductive technologies. Mm-hmm. Yeah.
Interesting stuff. And the fact that hormonal birth control has been shown to suppress AMH. I think
I recently learned that.
Interesting. Mm-hmm. And I think
so AMH, it shows that it's not just like set in stone. It's influenced by other factors like being on birth control, and other, there's other things as well, other variables that it can influence it. Yeah. So it's not, egg quality and ovarian reserve. We're learning more and more that it's not, it's not just like the way it is. It's changing all the time because
and
you're
responsive to your diet and lifestyle.
Exactly. Yeah.
Really important.
And inflammation and toxins and stress, all those things.
I love that. Let's kind of wrap up with some of the things that you do personally and how your mindset has changed. Because, when you, a lot of women, when they go to a restaurant, they might order the boneless, skinless chicken salad, right? Yeah. The salad, the light, items.
Yeah.
And why is that not necessarily conducive to helping body composition, but also hormone health? Like, and what would you eat? You go to a restaurant, going out to dinner and so forth. What do you like to choose for in terms of foods that support hormone health?
Well, I am always prioritizing protein at every meal. So if I'm going to be eating in a restaurant, I'm going to look for that first. I'll look for what's going to supply me with a good amount of protein. And, not just like a few pieces of chicken. It's like, I want a good substantial amount of protein. Otherwise, it's like, then I'm going to have to go home and eat more. Nobody wants to do that when you're spending a lot of money to eat in a restaurant. So that's always first. So, my favorite thing would be a good steak probably. But I like fish, I like seafood. So any good amount of protein. And, for me personally, I have learned over the years through trial and error that I also do really well with carbohydrate. I'm very athletic and active, and so I really need that energy. So I'll look for that as well. I want to have a good sort. I know now that if I were to eat, just a salad with protein, I would still not feel satisfied because I do need those carbohydrates too. So that's what I would be looking for.
Interesting. And you had been vegan at some point in your life, right?
I was actually never fully vegan, but I was very much vegetarian for a long time.
And how is your digestion now compared to back then?
Way better. Way better. I dealt with a lot of constipation and bloating when I was vegetarian. So, it's definitely eating meat has made such a huge difference. I think that's my digestion for sure, but just overall health and vitality.
It's important for people to hear. Now, the impetus for most, particularly women, going vegan or vegetarian is because of animal cruelty and the like. So how do you reconcile mentally with that? And what was it in your mindset that may be shifted that caused you to be more open-minded about having more animal products in your diet?
Mm-hmm. I think we might have talked about this on the first podcast that we did, but for me, a huge turning point was when I was in medical school and we had cadaver lab, and I saw what human bodies really looked like, beneath the surface and beneath all of our skin and everything. It's just like, it's muscle, like it looked like meat. And so something just kind of clicked in me when I saw that I was like, oh, we really are meat. Like, we're pieces of meat. So it kind of makes sense that we would need to consume that to maintain our own, structure and health. And the more that I learned too about the body, I just realized that we are literally made up of protein. And so if we're not eating it, if we're not eating high quality sources of protein, how can we maintain our, just physically, like our muscle, our bones, our hair, our skin, our nails, all of that is amino acids. All of that is protein. And so, once I started to understand that, it just really changed everything for me.
Right. Just seeing that actually histologically. Yeah. I think that's really important for people to recognize. If we could just finish up on herbs and things, a lot of men are taking Tunga Ali and ashwagandha, bovine testicle extracts, all these things, right? What is it for women that is like, is there a high hit rate with, say, black cohosh, or are there herbs that women can take that, and I know there's all these combination formulas out there, but have you found in your practice, like, most women would benefit from this or that adaptogen? Is there any high hit rate items that?
I tend to be more on the sort of conservative side with saying, like, oh, this specific supplement or this adaptogen. Adaptogens, I think they can be useful for sure. And like you were saying, there's a lot of different blends, like with ashwagandha and rhodiola and various adaptogenic herbs. Maca is another one. And they're great. I mean, they can be useful. They're a tool. But again, like I've never seen personally them be like kind of the magic fix. I have only seen lifestyle and nutrition and sort of like the way one relates to themselves, like kind of their relationship with themselves. That really, to me, is where the magic is. Because supplements can be, they're helpful, but they're not going to do the real work that like you have to do. We were talking about like being responsible for your own health. And what I believe we're most impacted by is just the ways that we're taking care of ourselves. So no pill can really solve everything.
Right.
But yeah, I mean, like sometimes it can help with improving sleep, taking something that's calming, like a calming adaptogen, or magnesium at night, theanine, things like that. I am a fan of some of the formulas that just help with calming the brain and the nervous system. So whether it's a nutrient or whether it's a botanical, I think those can be really help with just helping to calm the brain, because a lot of people have that right. Like thinky brain that won't turn off at night. And which again, but that's like a product of our lifestyle and how we're living.
Right.
So it's like the supplement can help, but it's not addressing the underlying reason that that's happening. And that's because of your, like how you're living your day. Yeah.
That's a really excellent point. Elly, really appreciate you coming on the show, sharing amazing wisdom. If folks want to work with you, you have group coaching as well as individual coaching.
Mm-hmm. Yeah. So I work with women one-on-one, as well as I have my group program, which is called the Fueled and Feminine Metabolism Mentorship, which we're starting next month in June. We're starting the next one. So
nice. That's awesome.
Yeah.
And that's like you do weekly calls and things. How long is that program?
It's 12 weeks, and there's a weekly like pre-recorded lesson that I send out, and then we have weekly group coaching calls as well.
That's awesome.
Yeah.
And women can enter that at any place? Do they need to have testing beforehand? Or?
Nope, there's no testing. It's not that. So testing I only do with one-on-one clients. So this is just like an educational curriculum that I've created. And then you have the support and the coaching from me too.
And then hearing stories from other people. I think that's really helpful for people. Like what worked for this person, what the problem was, and how they,
Yeah. I mean, people don't understand the power of being in a group setting until they're really in it. Because when you see sort of like you get to hear and be a part of somebody else's experience, and then you become invested in their, what they're going through, and then they're supporting you and they become invested in you, and you have, you have this connection with the group. And it also sort of helps remind us the importance of community in our health and our healing.
That's so important. Yeah. I found that the group sessions, people get a lot of value from that.
They
and
really
they become
do.
friends afterwards.
Yeah,
or
exactly.
didn't know that they lived in the same city as someone else. And because when we start to improve our health, we sort of close our circle a little bit,
Totally.
Sometimes, because most people just want to watch Netflix and order fast food from Uber Eats or whatever else. And if you're not wanting to be like that, then you want to seek like-minded people. So I think that's really important. So I'll put, and the URL for people to...
fueledandfeminine.com.
Amazing. Awesome. Appreciate you coming on the show.
Yeah. Thanks for having me again.